Hey Allison, how are you today?
Good, how are you?
Great, thank you for asking. My name is Ashley, and I'm a certified occupational therapy assistant.
Okay.
What occupational therapy is it's a form of therapy in where we want the patient to get function independently and safely during their daily activities, as well as activities that they enjoy doing.
Okay.
So I read in your chart where you recently suffered from a stroke, leaving some weakness in your left arm. Is that correct?
Yes.
All right. So what we're going to do today is passive range of motion, and with passive range of motion, I will be performing the motions in your arm. So you will not be doing anything.
Okay.
This will help benefit blood circulation, joint mobility, and help with pain management as well.
Okay.
All right, so does that sound like something you're ready to do?
Yeah, sure.
All right, great, let's get started.
Okay.
So first, I'm going to ask you to get comfortable, to go ahead and have your feet both flat on the ground.
Okay, sure.
All right. So I'm going to go ahead and get behind you if that's okay.
Sure.
All right, let me go ahead and adjust you this way.
Okay.
All right, and so for the first motion we're going to work on is going to be your shoulder joint. And so the first one we're going to do is shoulder flexion. Now, before I begin, anytime you feel any pain or anything, please, feel free to stop me and we can move on.
Okay, sure.
All right, so it's really important to have proper hand placement when you're doing these range of motions. So my first hand is going to be on your shoulder joint, and my other hand is going to be on your wrist. Your wrist is going to be in a neutral position, and what's easier for me to do, because I'm shorter, is to have you in this position where your elbow is at a 90-degree angle.
Okay.
And so what I'm going to just do is I'm going to kind of glide your shoulder back into extension. We're going to go ahead and do that 5 times. How does that feel?
Feels really good.
All right, perfect. So now we're going to go ahead and do shoulder flexion.
Okay.
So this is going to be the same, except we're going to go the opposite direction. And what we want to do is only go until we feel slight resistance. We don't want to overdo it and further any injury or cause pain to you.
Okay.
All right, so again, we're going to make sure we're supporting that shoulder joint. How does that feel?
Feels really good.
All right. All right, so next movement we're going to go ahead and do is shoulder abduction and shoulder abduction. And so what we're going to do is we're going to support your wrist again, support the shoulder joint as well. We're going to extend the arm out in front of the body. And then, so we're going to go ahead and do shoulder adduction, and that's going to move, we're going to move your arm towards your body. All right, how does that feel?
Good.
So now we're going to go ahead and do shoulder abduction.
Okay.
All right, again, we're just going to slowly move the arm out, make sure we're supporting the shoulder joint as well as the other joints. Stopping once you feel slight resistance.
Okay.
One more time. All right. Perfect. All right, so the next one we're going to go ahead and do is shoulder internal rotation.
Okay.
So we're going to go ahead and, again, stabilize the shoulder joint, hand on the wrist, and we're just going to make sure the elbow is tucked in. That kind of helps support it as well. We're just going to go ahead and move it in, and that is shoulder internal rotation.
Okay.
How's that feel?
Feels good.
All right. Now we're going to go ahead and do shoulder external rotation.
Okay.
On this one, you don't want to come out too much. You should be able to feel the resistance. All right, perfect. How did that feel?
Felt fine.
All right, so now we're going to go ahead and move on to elbow flexion and elbow extension. So again, with elbow flexion and extension, we're going to go ahead and make sure that your elbow is tucked in at your side for the added support. Your wrist is going to be in a neutral position, and we're going to have I'm going to have my hand underneath your wrist. So then we're just going to go ahead and raise the forearm up towards the shoulder joint and feel for that resistance. So this is shoulder flexion. Nice slow movements. Nice. Okay. So again, back in neutral position, we're going to go ahead and go into elbow extension. Maybe grip around there might be a little better. Go all the way down. Perfect. You want to remember that we're also paying attention to the patient's facial expressions to see if we notice if they're feeling any pain during the movement. All right, how'd that feel?
Felt fine.
All right. Now we're going to go ahead and do elbow supination and elbow pronation.
Okay.
So again, we're going to support that elbow joint, support the wrist joint, and it's going to be in a natural position. And we're going to go ahead and do the supination first. And with the supination, all you're doing is just turning the wrist towards the ceiling. So the palm's going to be facing the ceiling. And then turn it back to neutral. And that's supination. All right, now with pronation, we're going to have our hand placement in the same spots. This time we're going to, bless you.
I'm so sorry.
So this time we're going to go ahead and put it in pronation.
Okay.
And so it's just the same hand placement and just moving the wrist towards the floor.
Okay.
Back to neutral. So again, this is elbow pronation. All right, nice job. How'd that go?
Felt fine.
All right, so now next we're going to go ahead and do your wrist movements. So I'm going to ask you to spin around.
Okay.
All right, now for wrist movement, hand placement, my one hand is going to be on the wrist, on the patient's wrist, and then my other hand is going to be gripping the fingertips. So we're going to go ahead and start off with wrist extension, which is just raising the wrist up towards the sky, back down. Again, we're just going to do 5 reps of each. How's that feel?
It's good.
All right, now we're gonna go ahead and do wrist flexion.
Okay.
And with wrist flexion, it's gonna be the same hand placement. And you know, it's really easy to do this on a table because it kind of helps being able to put the wrist into flexion position. All right, how does that feel?
Feels great.
All right, perfect. All right, so now we're gonna go ahead and do radial deviation and ulnar deviation. All right, so with ulnar deviation, we're gonna go ahead and I'm gonna place my one hand on top of her wrist, and the other hand, I'm going to, again, just grip her fingers. I'm just going to move away from her body. All right, good. And now with radial deviation, we're going to go ahead and move her hand towards her body. Again, making sure that we feel for that slight resistance, and then that's when we know that we need to stop. You having any pain or anything?
No, no pain.
All right, perfect. All right. All right, so next we're going to go ahead and do the finger motions. So I'm going to go ahead and put her elbow in supination. And I'm going to go ahead and do her MCP joints first. We're going to just flex, put them in flexion, then extension, flexion, all right. So now we're going to go ahead and do, the easiest way is to do all the joints in the fingers, is to simply just take the tips of the fingers and just roll them up to make a fist, and then unroll them into extension. And we're just going to do that 5 times. Flexion. Extension. All right, how does that feel?
Feels good.
All right, so if we wanted to work individually on each finger, we could do that. So you could start off with the proximal IP joint. And so you would just bend it. So that would be flexion, and that would be extension. Flexion, extension, flexion, extension. How does that feel?
Feels good.
All right. And then we're going to go ahead and move up to the distal IP joint, which is just the tip of the finger. So we're going to go ahead and hold the other fingers out of the way, and we're just going to focus on this joint. Flexion, extension. How's that feel?
Feels good.
Alright, so that was the fingers. Now we're going to go ahead and head towards the thumb. Alright, so we're going to go ahead and place my thumb on the CMC joint, which is this joint right here that connects with the wrist and the thumb. And we're going to go ahead and do flexion, which is just a downward movement, and then extension, which is up. So flexion, extension. All right, now we're going to go ahead and do the CMC, the thumb adduction and AB adduction. So let's go ahead and do adduction first, which is bringing the thumb towards the palm. All right, now we're going to go ahead and do the CMC abduction, which is just going to move the thumb away from the palm. How's that feel?
Feels fine.
Are you in any pain or anything?
No, no kind of pain.
All right, perfect. All right, so that was the fingers passive range of motion. All right, so that concludes our session for today.
Okay.
You did a great job, and it was really nice to meet you.
It's nice meeting you too.
Thank you.